You ready? Oh, we're waiting. Okay. They're filming this, so we're waiting for the... Okay. Well, welcome, everyone, to our ALS Neuromuscular Appreciation Breakfast here at KU Medical Center. I'm so glad to see all of you here today. Sort of a chilly day, but not as bad as a couple weeks ago. So I'm glad everyone was able to turn out for this update event, which we started last year. And I think our ALS research team thinks it's really important to do these sorts of events. It wasn't my idea, though. I got this idea from other neurologists in our department who have been doing this for a few years. So I think Dr. Pawa in Parkinson's disease has been doing this the longest. And they do one of these events once a year. And Parkinson's disease is a very common disease. ALS, fortunately, is not as common as Parkinson's disease. So he does his events at some hotel downtown, and they get 500, 600, 700, 800 people and their families to give them an update what's going on. And then Dr. Burns, our Alzheimer's disease researcher, along with Dr. Swerdlow, who you're going to meet in a minute, he started doing one of these events for patients and families 3 or 4 years ago, and it was very popular. And both of them, Susan Pressler from KU Endowment helps them, so I think Susan stepped out, but we thank her for putting this together. And I think for the Alzheimer's events, they're getting 100 or so patients and families and things like that. So ALS, it's a more rare disease than those very common neurodegenerative diseases, Parkinson's and Alzheimer's, but there's some themes that's similar in all those diseases, all three diseases that you're going to hear a bit from Dr. Swerdlow. So even though our group is smaller, this is about the size we got last year, 30, 40 people, we think it's very important to have these events. And I'm very glad that Becky Cooper and her group from the Keith Worthington ALS chapter decided to film this. So I think it'll give us an opportunity to put it on one of the KU websites. It'll probably go on your website, and we maybe can make DVDs for the people that don't do the internet, and so they can get an update. So we're not going to take a lot of your time today. We're going to try to compress this in an hour, and I know some of you have questions too. I've already heard a Lipitor question that we need to answer, Dr. McVey, and so I think I'm very glad that we have patients, families, representatives from the ALS community, from the Keith Worthington chapter. I know we invited the MDA folks too. They didn't come. Dr. Dick works as a director of the MDA clinic and sees ALS patients. So we have a wide range of folks here to hear what we are doing in ALS at KU Medical Center today. And I think we're doing a lot. Basically, to just sort of sum it up in a couple sentences, I think that the scientists and the physicians and the healthcare providers here are truly one of the premier ALS clinics in the country. We certainly service one of the widest areas. We serve a 5-state area. We get patients in, Dr. McVey will talk about this, 2 to 4 new ALS patients in a week that we're seeing. And so we are seen as the go-to place for ALS. If you're unfortunate enough to get ALS, the fortunate part is that we are a team that knows how to take care of this problem, and that's what we tell patients and their families every time we make a new diagnosis, so patients don't have to go to WashU or to Baylor or to Mayo. They can come right here and get actually not only as good but probably better care for their illness, and also more opportunities to be in research studies right here at KU Medical Center than anywhere in the country right now. So we're very proud that we put together this fairly extensive team. And this year we're going to do something similar, some things different. This year, Dr. McVey, our ALS Association Clinic Director, she's going to make some comments about how we approach ALS patients. Dr. Dick, we didn't have you on the agenda, but if you want to comment after Dr. McVey's and contribute that way, that would be great. Then I'm going to do a quick overview of ALS clinical trials that are going on and the ones we've done and sort of the future. And then we've invited 2 speakers this year that we didn't have last year, and one is Dr. Russ Swerdlow, who is a neurologist who also works in the research lab with cell cultures and animal models for disease, and he's going to talk about what we can learn about what causes ALS in the basic science lab. And then Dr. Weir, Scott Weir, from our KU Drug Development operation, he's going to talk about some really amazing, exciting things that are going on right here at KU Lawrence and KU Medical Center, and teams that are being developed, that have been developed, to actually find new drugs right here in Kansas City and eventually bring them to the clinic. And that's sort of a whole new program Scott's been developing over the last several years. So that's my introduction, opening comments. Again, thank all of you for coming to this event today. And I think next I'm going to turn it over to Dr. April McVey. So Dr. McVey, why don't you come up? Dr. McVey is a professor of neurology, and actually they didn't have your new rank up there, Dr. McVey. They demoted you, but I'll re-promote you. So she's a professor of neurology, and we've been partners seeing patients for longer than we want to admit, but almost 30 years. And so we work together in the ALS clinic, and she's going to tell you a bit what we do.
All right, thank you. Hello, everybody. Thanks for coming, and can everyone hear me as far as my voice? Is it carrying all the way out to the edges of the room? All right, great. Well, welcome. Everybody knows the gentleman here that's on the screen, that's on the left side of the screen. Does anybody know who this gentleman is? David Niven. And it's like there's many celebrities or well-known people that have had the disease, but he was actually someone who I thought that's interesting because I had not realized that he had passed away from ALS. The clinic overview, I want to just say ahead of time that there are 2 clinics that take care of ALS patients at the Department of Neurology at the University of Kansas. I direct the Alsa Clinic, and Dr. Barohn is the one who actually got it started for the first several years. And then Dr. Dick directs the MDA clinic and also has other faculty there like Dr. Wong. And so just because of where I work, I'm going to talk about the Alsa Clinic in particular. Just to start off with some general information, this is interesting. 5,600 people a year in the United States are diagnosed with the disease. We really don't have good numbers for how many people are diagnosed worldwide. The more advanced countries like Europe and Japan probably have better statistics. 30,000 Americans at any one time may have the disease up to that number. And then even though most of the patients that come down with this disease are between 40 and 70, with the average age of 55, we see patients, I've made the diagnosis in patients that are in their 20s and 30s, as well as 80s and 90s. And so really, there are even cases of disease in younger people. These are motor neurons. Motor neurons live in various parts of your nervous system. The lining of your brain has cortical neurons, but then there are neurons in your brainstem and neurons in your spinal cord. And depending on where those neurons are located, and if you start off with having progressive weakness of your hand, then those are cervical motor neurons or anterior horn cells. These are what they look like. This is a motor neuron that's not doing as well because of nerve disease. We diagnosed ALS based on a combination of upper and lower motor neuron dysfunction. I'm just going to briefly tell you that before we go into the clinic. Here is a picture where you have the upper motor neurons that live on the surface of the brain, the cortex. These upper motor neurons tell the lower motor neurons in the brainstem and the spinal cord what to do. The lower motor neurons in your brainstem and spinal cord directly send communication axons to the muscle fibers. And so based on the fact that they're located in these 2 different places, we have, as a neurologist, ways of identifying upper motor neuron dysfunction and lower motor neuron. So here's upper motor neuron, which most people that are familiar with cases of ALS or have ALS realize that it may have started on one side, maybe in one foot, or maybe one hand, or it could start in the throat. But because of this is typically very typical symptoms that you're aware of with the disease, if you have the upper motor neuron problem, then you're going to have weakness, stiffness, you're going to have very brisk reflexes as well. This sporadic ALS is the vast majority of our patients. Most of our patients, 95% of our patients have sporadic ALS. That means that it cannot be transmitted genetically. However, due to some recent studies that have been going on for the past 10 years, we know that there are susceptibility genes and that there are genes that people are more likely to have an ALS that may make them more prone, perhaps in combination with an environmental factor. So if you have a susceptibility plus something else, perhaps environmental, then that would basically lead to sporadic ALS. One of the studies Dr. Barohn's going to talk about is we're trying to find out how people come down with sporadic ALS environmentally as well. And there's an oxidative stress study which is looking into what is it about our patients that are participating in this study that they have in common that might lead us to figure out what is it that brings it on. We know athletes seem to have a bigger problem with it. There's literature now saying that veterans have a twice as likely incidence of it. We know that people that live in certain parts of the world have more of an incidence of it as well. But this is a slide that's a little mind-boggling because these are all the genetic or hereditary forms of ALS. You may not have known this, but look at how many there are. They may follow many different inheritance patterns. Some of these are childhood as well. But their genetics is exploding as a new science, and we're finding more and more genetically out about these hereditary diseases.